Modern contraception has transformed over the past century. The introduction of oral contraceptives nearly 60 years ago marked a pivotal shift, part of a broader movement that has helped drive the global fertility rate from 5.0 in 1960 to 2.5 today. This progress reflects not just medical advancements, but the empowerment and education of women.
Contraception should be individualized and not treated as something for the masses. But as doctors, not often we get the chance to have patients asking the right questions.
Despite advances, access to contraception remains uneven. Proximity to care doesn't always mean access to choice.
Each person is different, and each person has different types of barriers and things like that. So it's important for us to be mindful, of the experiences of different people.
In the United States, more than 19 million women live in contraceptive deserts. These areas lack adequate services due to provider shortages, state policies, or funding gaps. Common barriers include long wait times, transportation challenges, and high out-of-pocket costs. Mental health also plays a role.
If someone is suffering from depressive symptoms, they're not motivated enough to ask those questions about risks and benefits of choices available to them. Anxiety leads to avoidance. Some of the students that I service are so anxious that they avoid the topic. They don't want to talk about it, even though they are in relationships and they are sexually active.
During their discussion, the roundtable panelists repeatedly highlighted one foundational solution: education. Since the mid-1990s, contraceptive education for teens has declined dramatically. Today, just 20 states require contraception be included in sex ed, and only 26 mandate medically accurate information.
When we don't do the education, there's a gap, and then our teens and young adults, they're curious and they want to be healthy, and so they go seek other resources. And those resources sometimes can be valid, and a lot of times they're not.
I personally think that students are not well aware of what all of their options are.
Without formal education, myths take root. Many young people rely on friends, social media, or hearsay. Clinicians can counter this by meeting patients where they are with honest, judgment-free conversations. The panel emphasized the importance of creating safe spaces for these conversations, where young women feel supported in trusting their decisions. They also highlighted that clinicians should be mindful of the educational opportunities they can offer patients, both in and outside of the exam room. Culture and society shape attitudes and access to contraception. In some households, the topic remains taboo.
We are social beings, right? So we operate within the context of our society, the social framework, also with the psychological framework. But most importantly, the conversations should start by individualizing the encounter. Like, what is your challenge? What are your thoughts about contraception?
My teen patients who are pregnant, I always ask, what led you to this situation? Like, how can we do a better job? And it's not uncommon to hear that in my household, we don't talk about contraception. We're not allowed to ask about it.
Peer pressure and social media further complicate decision-making, often pushing young women toward popular methods, not the ones best suited for them.
There's a level of shame with it too, like this shame of not knowing. It's okay that you don't know. A lot of us don't know, and so that's okay.
Well, it's because our system never taught you, and it's not your fault. Mm-hmm. And so just normalizing it, saying why would you know? Seems to really help them.
Clinicians on the roundtable panel highlighted a gap in family health history discussions, which can guide better contraceptive choices, especially with hormonal methods that carry risks like high blood pressure and blood clots. Research shows that encouraging patients to gather this information, even via text or during family visits, can improve outcomes.
I think that's something that we should definitely keep pushing for the medical school's curriculum to include. How do we engage in meaningful conversations with our patients? And sometimes it doesn't cross your mind to have the conversation or to redirect it, especially with young people.
A wide range of contraceptive options exists, but most are for women. Men, by contrast, are still limited to condoms and vasectomy. This disparity places considerable pressure on women to stay informed about the latest developments in this field.
Now, our options really only have a few really effective non-hormonal options. And so what would be really nice is to have more of a balance of the non-hormonal with the hormonal options, also for both the female and the male.
For many patients, the difference between confusion and clarity lies in provider communication.
How can we reshape the way we approach it as clinicians to make sure that we advocate for our patients by providing all the choices available without taking our own biases into consideration?
So, I think it starts with having a generous listening time, listening to the patient and to their specific needs. And by generous listening, we mean be non-judgmental and open to what the patient is bringing to the encounter.
Research supports this approach, showing that shared decision-making can improve counseling outcomes and patient satisfaction. Additionally, using clinical decision aids and standardized protocols ensures all patients receive consistent, evidence-based information about their options. To ensure equitable access, we must address disparities based on geography, race, identity, and disability.
When we think of reproductive health care or when we think of contraception, I think we have a certain image in our mind of like what that person looks like. When we have that image in our head, we're forgetting about everyone else. We got to think about like the marginalized populations, such as like the Black population, Indigenous folks, disabled folks, the LGBTQ plus community. Like oftentimes they are left out of like these conversations, right?
I think there's definitely layers. And so if we just even pull back and look at physical like equity to access in rural areas, that's a problem. There's definitely deserts, got what they call contraception deserts across the country. And certain states have very, very limited, not just education, but actual options that they're offering depending on the regulations of that state. They also put some restrictions on minors and the ability for minors to access contraception without their parental consent. And so you see a variety of that. If you just look from west to east across our own country of access, physical access, there's inequity there for sure.
There is broad consensus about the need for culturally tailored counseling services. Service providers have noted that aligning contraceptive counseling with community-specific values and language can significantly enhance patient trust and adherence. With a wider range of choices than ever before, counseling should begin by understanding what motivates a young woman to seek contraception, then walking through all options, barrier methods, pills, injections, patches, and long-acting options like implants or IUDs. Providers should help patients weigh the pros and cons of hormonal versus non-hormonal methods based on their health history and refer patients to clinics offering additional options when needed. Supporting informed decisions and finding the best fit for each woman's body and life.
I'm a strong believer in like meeting people where they're at. And so like if you can somehow get to them in the community, like get to them directly, and having those conversations is also helpful.
Patients don't want to be told what to do. They want to feel supported, heard, and free to change their minds.
With my patients in the psychiatry clinic, I always start with a very direct approach because it makes it non-judgmental. And I'll just say, have you ever had a formal education visit with a provider about sex education and contraceptives? Just very simple question. And they'll pause. Some of them say, well, my friends told me. I'm like, no, I mean like if someone who's trained. And they'll say no. And then I refer to the providers in the clinic for just education visits. They like it.
Patient satisfaction doesn't come from being told what to do. It comes from feeling heard, respected, and empowered to make decisions. The panelists emphasize that choosing a contraceptive method, especially a short-term one, shouldn't feel like a lifelong commitment. Patients need to know they can change their minds. Just knowing they have the option to stop or switch methods if something doesn't feel right can bring real relief and make the whole experience more positive. For young people, the challenge isn't just contraception, it's navigating a system they often don't feel welcomed by.
Many of the students I speak to will say, yes, I've been having unprotected sex and I've been thinking about birth control, but I just didn't know where to go. And that sounds so alarming because you can find it in so many areas, but it's really that is sometimes the most common answer I get. It's like, well, I didn't know you all were here. Or how do I get access to contraception if I know my parents don't want me on it? Or just to even learn about it, I'm not allowed to ask.
Education is always key and empowering and helps the student to grow, not only make informed decisions, but grow in their decisions too. I mean, it's a holistic approach, right? So we ask about diet, about exercise, about sexual activity, and it's all part of this conversation.
The role of the healthcare provider is to be a trusted guide, not to pursue perfect ratings or scores on the internet, but to offer thoughtful, evidence-based support so women can make decisions that meet their needs. When selecting a contraceptive, side effects and risks are key, especially with hormonal methods that can lead to serious complications like elevated blood pressure and blood clots. Choosing the right method is about weighing benefits and risks, just like any other medication.
The best way to empower patients and young women to make a decision is to guide them as what to ask. So have you asked about all the side effects? But how are they to ask if they don't know that this could be a potential side effect?
Panelists noted that weight gain is a common concern, often discussed on social media. The side effects most talked about are often the more common ones, leaving less common but serious risks, like high blood pressure or blood clots, largely overlooked. Blood clots, such as deep vein thrombosis or pulmonary embolism, are serious risks linked to hormonal contraceptives. These risks vary depending on factors like estrogen dose, progestin type, and personal health history.
But, it's unrealistic for a non-clinical person to be expected to understand that even within the range of birth control pills, there are different types of hormones that cause different types of potential side effects. So for one person, it could be that this particular brand of pills tends to cause more headaches or more water weight gain than another. So I think that's where things can get a little bit challenging in terms of our ability to express that to other patients.
Women who use combined hormonal contraceptives have a 3 to 5-fold increased risk for blood clots compared to those who don't. This risk is even higher among women who smoke, are obese, or have a family history of clotting disorders. Though the absolute risk is low, educating patients about both the most common and the less common side effects is crucial for informed decisions and could save lives. The panel stressed the importance of proactive education. Many young women don't recognize the risks of blood clots, feeling healthy and unaware of the potential dangers.
We make appointments to see our doctors to treat, to correct, to get better from a symptom or something that we might be experiencing. But rarely do we make an appointment to prevent, and even more rare, do we make an appointment to get educated. So I think it's definitely both ways, like the provider having the ability to meet the patients where they are, and the patient having that initiative and the willingness to be educated about the decisions that they're about to make.
The key is making decisions based on clear, accurate information. Studies show that when patients understand both the benefits and risks of their contraceptive options, they're more likely to be satisfied with their choice and stick with it long term. Emergency contraception plays an essential role in reproductive health care, but it's often misunderstood. by both patients and providers.
Contraception, like you said, is very popular now. It's on campuses, and it's not just giving out condoms anymore. It's like giving out emergency contraception to try to promote the awareness, which is great. I think the challenge is that we pass it out, we don't pass out education with it, right?
As the panelists emphasized, emergency contraception should be seen as a backup, an option for when regular contraception fails. The conversation highlighted the need for better education. The roundtable panel emphasized a collective call to action involving healthcare providers, education institutions, policymakers, and patients. Healthcare providers should integrate contraception education into routine care, offer trauma-informed, bias-free counseling, and support shared decision-making to empower patients with informed choices. Schools should implement comprehensive, evidence-based reproductive health education and expand campus health services to ensure all students have access to a full range of contraceptive options and accurate information. Policymakers must increase funding for contraceptive services in underserved areas, mandate comprehensive sex education, and support the development of innovative, affordable contraceptive methods. Patients and advocates should seek accurate information, voice their needs for transparency, engage in grassroots outreach, and utilize technology to enhance awareness and empower informed decision-making. In closing, the roundtable panelists emphasized that true reproductive autonomy is achieved when patients are fully empowered through comprehensive education, empathetic support, and equitable access. Informed contraceptive choice means more than selecting a method. It's about ensuring young women have the right, power, and support to shape their own future. By amplifying patient voices and using evidence-based practices, we can drive the systemic changes needed to break down long-standing barriers. When informed, patients become powerful advocates for their own care. Through ongoing collaboration, education, and advocacy, we can move toward a future where contraceptive care is truly patient-centered, equitable, and effective. To view or download the full proceedings of this roundtable in both print and video formats, please visit the Rowan Foundation's website,